So today we had our unveiling of our new name and logo and tagline for the new residential withdrawal management and safe bed site.
A year ago, on April 25th, 2022, Sault Area Hospital began the construction and retrofitting of this facility, which will provide 20 residential withdrawal management and safe beds.
I think it's an exciting event where the name unveiling of our Withdrawal Safe Bed program. So we're all excited as a program to have this process completed, and we're looking forward to the next phase, which is the grand opening of the facility for us to provide care and support for individuals with substance use, concurrent disorders, and associated mental health difficulties.
It's a significant need in our community and long-standing. We've been working towards this for quite some time. We've had a number of service enhancement over the last 3 to 4 years that have allowed us to provide a higher level of care, a more intense level of care, but we are quite limited in our number of beds right now. So this site in particular will give us 20 private rooms, 20 private bathrooms, and be able to provide that continuum of care.
So for everyone who is in this room, who feels so passionate about the help that we are trying to provide to reach a solution in this crisis, I ask you to remember all the other pieces that are out there. And make sure you're speaking to people out in the community to make sure that when you see someone in a form of crisis, when you spot them at a young age, make sure they know that there are places like Algoma Family Services that can help, that they know that the Children's Aid Society has programs that can help, that they know that within our elementary school system, within our post-secondary school system, within the secondary school system, there are supports within those places that can help. We need to look at how we can tackle these problems before an individual ends up in a place like this. Wherever possible, we want to make sure that this is the last piece to trying to help a person struggling through an addiction crisis.
My role is going to remain as a serious advocate and also as a physician to provide support for these clients as well. And my team, the mental health and addiction physician team, are excited about this project and how we're going to be able to support, these patients long term too.
So we're actually going to head to what is the main lobby.
So this was the Sault Star building here in Sault Ste. Marie, and a very large and deep floor plan that's here. So unlike where a new build residential plan might have had wings so that you had a room, a corridor, a room across from each other between outside walls, here you have a lot more that's interior. So all of our client and resident rooms are around the outside of the building, so everyone has a window, natural light coming in, and a lot of the programming and residential living spaces are then on the inside of the building. Here behind me. So it makes it, certainly was a challenge as we looked and worked with our designers and architects on how to make this work, how to have an acute side and how to have a post-acute side for the clients. But I think we resolved to a great place here and a really good design that makes for good flow.
It's absolutely in conjunction with Sault Area Hospital and a number of our other community partners. So including our emergency medical services, our police services, Canadian Mental Health, social services. The list is too long to name, but my role in that, I'm the clinical director for mental health and addictions at the hospital, and working to support the leaders and the staff that are providing that care and arranging those collaborations, the pathways. My work is to help them make that happen.
Post-pandemic, we're beginning to see more and more people engage in use of substances, and having a facility like this to provide that level of support would really, really help us to provide the biopsychosocial model of approach to care and also supporting them with regards to their spiritual needs.
This, of course, is an opening to the dining space where we had the event.
I think it's just going to be night and day in terms of the care that's going to be able to be provided here. We were operating out of somewhere around 2,900 square feet down on Queen Street. This part that we are developing right now is about 17,000 square feet. We're going from rooms that had up to 6 beds in them as a shared ward room down there, to all individual rooms, all individual bathrooms for now 20 residents instead of 16. Some people do arrive here with everything that they own, and we've designed the space. We have a personal belongings storage area where, even though we have rooms that are all individual and there's storage under the beds and different storage in the rooms, we do also have locked storage here that clients can use to keep their belongings and have them returned to them at the completion of their time here. So the capacity is there, but really I think this is about giving people a space that feels more like home, and just a really therapeutic, relaxing place to be able to get the care that they need.
I think it is a fairly intense level of care. If someone needs care more intensive than this, they're at hospital, they're in a medical bed or perhaps a psychiatric bed or an ICU bed. Along that continuum of care, we think of things like public health, early intervention, prevention. Ross had mentioned the school system, and then our community partners, all of our community members, as far as making sure that our young people and our adults and older adults feel connected. They have connections and supports in our community that are beyond mental health and addictions, social supports.
There's a lot of stigma around mental health and addiction, and I think we need to do a lot of teaching, health teaching, that these clients or these individuals need to be supported. And we do need the community as well to provide support in terms of volunteering for this space, to provide care for these people who would need everyone's support to be able to get past this difficulty that they have.
Timeline at this point really driven by supply chain for our air handlers and our generators. So we are expecting those early summer, early to mid-summer, and hoping for an end of August grand opening.